Hey everybody, Dr. Justin here with Expressing Life Chiropractic, and tonight is going to be the last night of our Part 4 or our 4-part series of Your Choice During Pregnancy and Birth. And so tonight, as we get started, this one's going to be much shorter than the rest of them because this is just going to kind of bring everything together. But again, the big message and the big key that we want you to get is going to be the fact that you can and you get to be in control of not only your birth, but more importantly, your pregnancy. And so I think we may have the wrong slide here, but we will get that changed. Give me just a second here. And we'll take a look. And so let me flip over here real quick. There we go. This is the one that we want to be on. Again, tonight's title is Enhanced, Transforming Your Pregnancy and the Health of Your Children. And it's really important for us. And again, the whole reason that I've gotten into prenatal, chiropractic is the simple reason, just because the kiddos have such a better opportunity, not only during pregnancy, but more importantly in the first stages of their life. We want to be able to help them remove all the interferences and stress that comes on not only through pregnancy as well as birth. But you know, there's this ability to help not only you as mom to thrive, but also your newborn baby. And that's why it's so important for us, for you to be in charge of this whole entire process, this whole entire decision making, so that you can be able to enhance your life and your baby's life. So again, take the will. That's been the big concept over the last 4 weeks. And I want to put it all together, and really it's for you to be able to choose your optimal birth. We talked last week about the nervous system and how that affects not only you, but also the baby and the development of the baby, and the importance of removing that stress and really creating that balance. But again, the first step is for you to educate yourself, right? And tonight and the last 4 weeks, what you've done is really part of educating yourself. And I know that you have looked into other things and know, and that's the great thing. Again, I just want to encourage you, if you have not, that you have that option, that you can be in control. So many times we're told that, you know, the doctor needs to be in control, and that's not the case. You know, this message falls close to my heart just because I didn't have that. I didn't know this when my 12-year-old was going through this, when we were going through this. I didn't know that we could be in charge, that we could ask questions that didn't really seem right at the time. We just kind of followed blindly because that's all we knew, right? The other thing that we've talked a lot about is really choosing your team. You know, it's kind of been a big topic of being the captain of your ship or of your team. And you get to choose who you want to bring on this amazing journey of pregnancy and birth and into the early stages of your baby's life. And so again, you know, we work closely with amazing midwives, as well as doulas and massage therapists that work with pregnant mamas. And those are all things that are going to help benefit you and baby during your pregnancy. The next thing is really having a plan. You know, a lot of times if we don't have that plan, then that's kind of when we fall into being led blindly, and we're not really on top of being in control or being the captain of our ship during this pregnancy. And so it really, I encourage you know, along with your spouse, if you're doing this on your own, I encourage you to sit down and spend time mapping out the route that you want. If you remember right, we talked about, we showed you that map, right, from the house all the way to the hospital and everything in between. Well, you get to map out that path from really conception all the way to birth, right? and you get to be in charge of that. And so that's what we want you to take away over these past 4 weeks is the importance for you to be able to be in charge. The other thing, stay focused. Now, this is a long process, right? You may have to make some big changes or make some big decisions if you really want your optimal birth plan. But I can tell you that it is truly worth it. You're going to feel much more encouraged. You're going to feel more empowerment. And those things are really, really big, especially for a mother that is wanting to connect and enjoy her pregnancy and birth. And I understand that, especially those mamas that have gone, births at home and all those kinds of stuff. I know a lot of the midwives here really encourage you as mama to be the first one to touch baby as baby comes out because of that important connection, that important bond, right? My ex-wife did not have that opportunity. Actually, she was probably one of the last ones to touch my son because of everything that she went through at that time. And so there was really a disconnect between the both of them. And that continued on for many years. And so that's one of the greatest things about being able to have that first connection with the amazing gift of having your baby. And then the other thing is maintaining balance, right? Life happens, stress comes on. And so it's always important that we remember to balance the bad with the good and be happy. So last time we talked about different prenatal exercises, right? Just kind of helping calm that stress. We also touched on how chiropractic helps with creating balance in the nervous system. As that negative input or that negative stress comes into the body, it creates that imbalance or that dysfunction in the nervous system where the body cannot send proper information and it is no longer functioning properly. Well, chiropractic helps because it puts that positive input into the nervous system through the chiropractic adjustment along the spine. Again, we talked about the spine is responsible for 70 to 80% of that positive input into the brain to not only help connect the nervous system so that it can heal, so that baby can develop properly, but more importantly, to help create that balance. So when mapping the journey of your birth, don't let anyone else take the wheel. And again, it's huge, right? You get to choose that. And that's why I've been so adamant about saying that you are in charge, you get to choose that. And it really is personal to me because I didn't know that, I didn't choose, I didn't ask questions, I did not step up. And it's not a guilty situation, but I want moms, I want dads to understand that they have the ability to do that. We see so many kiddos here in the office that come in that are on the spectrum, that are suffering from anxiety, ADHD, sensory issues. And 95% of all those kiddos, chronic ear infection as well are a big one, constipation. But 95% of those kiddos have had some sort of birth trauma or stressful pregnancy. And that is why I want this message out there so that you can realize that you get to have the pregnancy and the birth that you have always wanted and to help with that stress, right? Stress is a big killer. And so if we can eliminate that stress through the different activities on top of removing that interference through the chiropractic adjustment, then not only will you be functioning at your optimal level, but your baby is going to be able to develop at an optimal level as well. So enhance the health and well-being of your pregnancy, delivery, and child. We really talked about taking the wheel, taking charge, choosing your team, which will then allow you to enhance your birth. We're not here to tell you what direction to go. We just want you to know that you can choose, you can take the wheel and you can choose your team. We would love to be part of that team. Like I said, it is my passion. Pregnant mamas and kiddos are my absolute passion. I love working with them. I love seeing them thrive when they are under chiropractic care. I love seeing mamas, when they go to give birth, their stress levels are way lessened because they've been under chiropractic care. The labor time, all those things decrease again because their body is functioning. It's communicating properly so that when it is time to deliver and birth your baby, that it functions and works at the proper time, instead of forcing something that is not ready. And we all know when we force something, it is not good and it just does not work properly. So really, like I said, this was a short one tonight, right? We are going to be doing a live workshop in a couple weeks, and I will put information out there for you. But again, we're going to dive into this. I want to do it live as well because then we can really kind of communicate, share, open up, and more importantly, answer questions, right? If you have questions, please don't hesitate to email us, reach out to us on Facebook, reach out to us, call the office. But we're here to help. We want to make sure that you are not only educated, but you're empowered, and we encourage you to take the wheel and to create your birth team so that you can not only enhance your pregnancy and your birth team or your birth, and really allow your baby to start off the first few months not only in utero, but post-birth so that they can start thriving from day one. So appreciate your time. I appreciate you watching these videos over the last 4 weeks. And again, reach out to us. We're here to help. And we love caring and serving for families. So we look forward to seeing you here in the office, getting you scanned, checking your nervous system, and being part of that birth team. Thanks. Have a great night.